Hello, I'm Joy Holloway Davilar, and today's validations will be bathing a patient in bed and making up a bed while occupied by a patient. Before getting started, I'll identify the first 7 steps. Check the physician's order, wash my hands, assemble my equipment, identify the patient, identify myself to the patient, explain what I will be doing, and of course, provide for privacy. So let's get started on giving this patient a bath while in bed. The first thing I want to do is wash my hands before applying gloves, which I will go ahead and do right now. So my hands are washed. I'm going to apply my gloves, and after that I will raise the bed to a working position so I can get started on giving this bed bath. Okay. I'm going to raise the bed to the working position. And I'm going to lower the bed rail down. I have my equipment here. I have my washcloth and I have my basin, which is filled with water that I've got to a comfortable temperature. And to begin, I'm going to wash the face and wash the face, folding the washcloth into a mitt. So I'll start first with the eyes, and I'll work from the inner canthus to out. So I'll clean this eye, use another part of the washcloth, and I'll go ahead clean the other eye from in to out. Rinse that off. I will not be using soap while I'm doing this for the face. Then I will proceed to wash the rest of the patient's face. Making sure I get behind the ears, back of the neck, front of the neck, under the neck. Cleaning the face, rinsing as much as I need to, and drying off with my towel. After washing the face, I'll make sure that the patient has a bath blanket to provide for privacy, of course, and cover the patient while I will be washing the rest of their body. So the next thing I'm going to do is I am going to start removing the gown, and I'm going to wash the hand, the arms and the axilla. So take the bed blanket out. I'm going to spread the towel under the patient's arm like this, and I'm going to proceed to wash from the fingers to the axilla, making sure to hold the patient's joint. Washing the axilla, wash the arm, wash between the fingers, all here. And for this, we can use a little bit of soap, not make it too soapy, but you use a little bit of soap and you rinse. And I will dry this off, this arm off. After doing this arm, I'm slowly going to be removing the patient's gown, because I'm going to change the gown after I finish giving them a bath, and change the bed linen. So I want to, you know, remove the gown all the while providing for privacy under the bed blanket. So I'm going to continue to work my way down. I've done this arm. I'm going to go ahead and do the chest and abdomen. So I'm going to pull the bed blanket down like so, making sure not to expose the patient. I'm going to use the towel. I'm going to pull the bed blanket back, covering the chest area. And I'm going to get some water again, a little bit of soap that I have here on the side. Just lather this up a little bit. I'm going to come across here and I'm going to wash the chest area. I'm going to rinse. I'm going to get that all cleaned up, rinsed off. And after doing that, I will dry. Okay. I'm going to provide for privacy again. And now I'm going to wash the abdomen. So I'm going to pull the bath blanket up. I'm going to keep pulling the gown down because I want to get rid of the gown. I'm going to put a towel here over the abdomen. Make sure this is on the chest. Expose the abdomen. Right here I can take the gown off. Put it in the soiled linen container. And I'm going to go ahead and wash the abdomen. Soaping that up. Rinsing that off. And drying. Once again, removing that towel. And I'm going to right now work my way down to the feet. Now I'm at the patient's feet. I'm gonna put the towel under this foot right here. Spread this under here. For privacy. And I'm going to proceed to wash from the toes to the knee and from the knee to the thigh. So soap this up. Not too much lather. Continue up this way. Rinsing and soaping and washing as I go along, making sure to get between the toes because this is very important. And all the while doing this, I will be examining the skin for any, for any bruising, for any, beginning stages of pressure wounds, and seeing what is going on. So I rinse that off. I wipe all the leg, continue up, and I will dry this off. Dry this leg off, getting between the toes, drying the leg, and cover this over. In the essence of saving time for this video, the exact same things I did on this side, washing the arm from the fingers to the axilla, the leg again, from the toes to the thigh, that is also done on the other side. I would have gone around to the other side, lowered the side rail, and done the same thing on the other side for this patient. Now I'm going to go ahead and change the water because I will be doing the patient's back and buttocks. So I've changed the water and the washcloth, and I've got a new set of water, and I'm ready to go ahead and clean the patient's back. So I will turn them, position them. Privacy. Over to their side, and I'm gonna put the towel in the back here. I'm gonna go ahead and wash behind their neck and back, and making sure that I get the buttocks, and obviously definitely wipe from front to back. So we'll do that. Wash the back of the neck, rinse off. Again, being vigilant for any skin issues, making sure that the skin is intact. After rinsing the back, I'll definitely apply lotion. Before doing that, I'm gonna dry the back and apply any lotion. And we've done this to the patient's body, the bony premises. Apply lotion to the feet, making sure not to apply lotion in between the toes. So I've wiped the patient, dried them, and last, I'm going to take care of the perineum area. So I'm going to fold the bath blanket back. Again, making sure for privacy. Okay. When washing the perineum area, I'm going to change the water again and get a fresh washcloth. So I'm going to wash in between the legs, in between this area, and I'm going to wipe from front to back and around the sides of the genital area, be it male or female, making sure to wash and cleanse thoroughly. And dry the area thoroughly. If need be, you would apply moisture repellent, a barrier lotion, to ensure that the skin stays intact. Dry that up. Dispose of all my soiled linen, and next I will go ahead and change the patient's, put on a fresh gown on the patient after they've been bathed. If I need to, I can also wash the hair. I'm going to go ahead and underneath the bed blanket, I'm going to go ahead and give them a fresh gown. Clean gown. And all my linen I will set into the soiled linen basket. Next, I will proceed to make the bed while the patient is occupying it. So they've gotten their bath. I've checked everything, checked their skin, everything's intact. I'm going to go ahead and make up this bed while it's occupied.